Patellofemoral pain syndrome won't get better until you fix these two problems. Now I'm talking about glute strength, that's number one, and foot strength, that's number two. If you don't fix glute strength and foot strength, then you won't ever get rid of patellofemoral pain syndrome. That's pain in the front of the knee. These two problems are at the root cause of patellofemoral pain syndrome, and they set up excessive forces to go through the kneecap right on the front side of the thigh bone where it bends to make the knee joint. And the reason why glute strength is so important is because of its influence on the position of the thigh bone. If you look at the skeleton over here, the glutes are on the back of the hip and they connect to the thigh bone at the top of the thigh bone, and they influence the position of the thigh bone, which changes the position of the kneecap on the thigh bone. And then down at the foot, the reason why the foot muscles are so important is because if you don't have adequate support of the muscles that hold up the arch of the foot, then it can change the position of the shin bone, the tibia right here, and that can also influence what's happening at the kneecap. You can get too much pressure that causes rubbing, inappropriate rubbing at the kneecap, and causes that pain, irritation, swelling, doesn't let you run, doesn't let you even walk in some cases, or sleep at night, and it's just not something you want to be living with for any period of time. It can be fixed though if you get that glute strength up and that foot strength up. This video is a bit of a deep dive into the two muscle imbalances that I'm describing, the glute strength and the foot strength, so that you can understand the root problem that sets up patellofemoral pain syndrome. So first, let's talk about the glutes. The glutes are located on the back side of the hip right here. Everybody knows the glute maximus muscle. There's some deeper muscles there. Let me show you on my muscle model right here. So here's the leg. I'm going to take off the bottom part here, the shin and the foot. And right here is the glute muscle. And the glute max muscle is this big one. That's a hamstring that fell off. And then you have a bunch of little glute muscles in here. This is the gluteus medius. And then if you take that one off, you have, this one's connected to TFL actually. And then you have the gluteus minimus. And then you have a bunch of other little muscles, the psoas. And we call these the P-go-go-Q muscles. The piriformis, psoas on the front, not psoas. Piriformis is the P muscle. The gemellus muscles, you have a gemellus superior and inferior, and then you have obturator muscles, obturator externus, obturator internus, and then the bottom one is called the quadratus femoris, these muscles right here. And that yellow thing is your sciatic nerve. So this problem can be affecting your sciatic nerve, causing sciatica. But if you don't have adequate glute strength, you see all these muscles, they attach onto the thigh bone on the side, then you're going to have problems with the position of your thigh, because these muscles affect, they all attach right here on this bump right here on the outside of the thigh bone, and because of their pull on the thigh bone, they help to control some of the rotation. Well, here's where it's a problem. If you don't have enough glute strength and you tend to internally rotate, what happens with the kneecap here is it tends to shift outwards because the thigh bone is rotating inwards. And that shift right there causes there to be excessive bad pressure behind the kneecap and on the end of the thigh bone. And this is what sets up the swelling back there, the pain, the patellofemoral pain syndrome. And if it gets bad enough to where it damages the cartilage behind the kneecap or on the thigh bone, then we call it chondromalacia patella. That's where you start to get shrinking of the cartilage, thinning of the cartilage, or sometimes you get what's called cartilage defects, where the cartilage appears damaged on an MRI. Either way, both of those problems, chondromalacia patella and patellofemoral pain syndrome, what we're mainly talking about here in this video, are greatly tied to that glute strength. If you don't have enough glute strength to hold your thigh in a slightly outward position like that, the way that you normally should be, without having to consciously think about it, then your muscles are going to compensate in a way for you to still accomplish your everyday movements. You're walking, getting in and out of chairs, getting up and down, in and out of cars, up and down from bed, exercising, running. Anything that you do is going to be compensated with usually some thigh muscles and the groin muscles, the inner thigh muscles, and those muscles tend to pull your bone inwards right here, shifting that kneecap outwards. Now let's talk about the foot. Let me show you my muscle model. Here's the foot down here, and you have the shin, the lower leg. And if we take off the big muscle right here, the gastrocnemius, the one that makes up the shape of the calf in most people, then you have some deeper calf muscles. This would be the soleus, and here's the Achilles tendon. And then if we take that one off, here you have the deepest calf muscles. Now this is flexor digitorum longus, posterior tibialis, and then we have flexor hallucis longus, these three muscles back here. And they're important because they send these tendons, so you can see this yellow thing is a nerve, the red thing's a artery, and then the white things right here are the tendons that connect those muscles to their attachments down the foot. They run on the inside of the ankle and they go under the foot. Let me take this layer off here. You can see some of these white things that come off. Some of them are cut right there. They fan out into the toes. And so these are, they make some of your toe flexor muscles. And because they cross under the foot right here, they're in a position to hold up the arch of the foot. Now, if you don't have enough strength in those toe flexor muscles, then when you go to stand up and when you do other more intense activities like walking is a little bit harder than standing. And then if you do running or any sort of weightlifting, jumping exercise, if your foot can't be held up at the arch because those muscles right here are weak, then your arch is going to tend to collapse down and cause your ankle to collapse down, which causes the entire shin bone to collapse down. And if we look at the big model here, so arch collapses down, then shin bone's going to move inwards like that, and it's going to create the same effect as what the glutes did up here, the weak glutes at the knee with the kneecap. So it's going to cause this to collapse inwards like that. The shin bone's going to collapse inwards, and it's going to help, it's going to facilitate the thigh bone moving inwards, which then causes that kneecap to shift outwards and rub inappropriately down here. So those are the two big muscle imbalances that need to be fixed. They're those critical key factors that need to be fixed in order to get long-term relief from patellofemoral pain syndrome. I'm going to give you a couple of quick exercises that you can start to do to get stronger in these two muscle groups, but I do need to tell you this is a process. Strengthening the glutes and the toe flexors is a process that requires gradually harder exercises so that you can get to the point where you can run, be on your feet as long as you want, lift weights, not have any issues in your kneecap with your patellofemoral pain syndrome as you do all these activities. You have to have the support from those glutes and those foot muscles, the toe flexors. So the first big thing that you need to accomplish is gaining control over these muscles. So here's the exercise for the glutes. Just like I am right now, I'm sitting. I want you to sit and see if you can activate your glutes. So I'm going to do it, and you're going to see me just rise a little bit. And just hold it. And then after 10 seconds, relax and you'll sink down. And because your glute muscles tighten up, they thicken, and so it makes your body go up a little bit. It's kind of funny. And then after you relax, it goes down. But here's the thing. If you tightened your glutes and your thigh muscles all tightened up a lot too, that's a problem. That means you have an imbalance. That means that when you go run, when you go lift weights, when you go do something more active, and you're supposed to be using your glutes, your thigh muscles kick in too, and you're using the wrong muscles at that point. Now, it's okay to have your thigh muscles work, but it should be your glutes that are working primarily. If your intent right now was to engage your glute muscles, your butt muscles, and these muscles tightened up as much, if not more than, or in some cases, glute muscles didn't even fire at all. You tried and you're like, I don't feel it, but my thigh muscles are working hard. That's a severe muscle imbalance. And where you're at is just trying to get the glutes to work. And so the exercise is this. Instead of going 100% glute tightening, go 50%, go 25%, even 10 or 5%. And just get your glutes to activate without your thigh muscles overtaking them. Once you can get to the point where you can hold 80, 90, even 100% of a glute contraction with minimal to nothing in your thighs, then you're ready for more advanced exercises like maybe squats or lunges or other glute exercises, because now you're prepared to actually use your glutes when you're doing those exercises. It's kind of an open game at that point. As long as you're activating your glutes, you're going to be strengthening them without feeding into the muscle imbalance by working your thigh muscles. So there's a lot of flexibility. You can do you can get creative with which exercises you do at that point. Now let's talk about the foot muscles. When it comes to foot muscles, you need to make sure that you can curl your toes all the way. So if you think about bending your toes like this, you need to have the knuckles, like the knuckles in your hand, pop up right here. And if you're trying to curl your toes and they only go part of the way instead of all the way down, then you don't have enough strength. And there might be one toe that doesn't go down all the way. You need to help it out. Get your toes to curl all the way down by assisting it like this, and then use your foot muscles to get them to hold, and see if you can let it go without your toes uncurling and coming up because you don't have the support from your hand. If you don't have that kind of a support from your own foot, from your hand to get your toes down, then you're not going to be strengthening your toe muscles all the way down. Now this needs to translate into standing by flattening out your toes and getting that arch to come up. Because if you can see my shin and my knee, when I do that, it positions my shin better, it moves my ankle out, and it moves my thigh out even a bit, which aligns the kneecap much better. That's the end goal here, is to be able to stand with your toes down like that and use your toe flexor muscles appropriately. Getting your toe muscle stronger is kind of confusing for a lot of people. At least this is what I run into whenever I'm coaching people on this, because they start to think, well, do I need to do a toe curling exercise like with a towel where I'm pulling towels? Or they may have gone to therapy and were told to grab marbles and pick them up. And that's a good starter exercise because you're gaining control over the muscles and you're trying to get them to curl all the way. But it doesn't push the strength up to the level of where you want to lift weights or where you want to run. So what's necessary is to use your toe muscles in standing throughout the day, all day long. And then even lifting weights, like doing deadlifts, doing squats, anything where you're holding weights in your hand, even upper body exercises, but being conscientious of grabbing your toes and elevating your arches like that helps tremendously to strengthen those toe flexors and position your shin bones, your thigh bones, and your kneecaps correctly so that you're offloading the kneecap, the cartilage under the kneecap, and allowing it to be normal so it's not getting swollen, inflamed, and irritated. If you can fix that glute strength and fix the foot strength by starting here with these exercises and then taking it to the next levels, adding more progressively harder exercises, then you're going to be in a position where you can get rid of chronic patellofemoral pain syndrome, and more importantly, prevent yourself from getting worse knee problems like meniscus tears, knee arthritis, and even beyond that, having to get a knee replacement or any other surgery like a meniscus repair surgery or a debridement surgery where they clean out your knee joint just so that things are smoother. Because even if you have those surgeries, and you never fix this root problem, you never get the glute strength and the toe strength, which, as you've seen, I've explained to you here, and it's not that complicated to grasp. You just have to do the work. Then you can prevent a life full of knee problems. You can totally eliminate it and be able to be active and healthy, do whatever you want to do the things that you love to do without worry that your knee's going to swell up and hurt and miss sleep over it. You need to enjoy your relationships and not be slowed down because you're that person that says, well, you all go ahead and go on that hike, you all go ahead and go on that walk, I'm going to sit here and need to rest my knee. You don't need to be that person. Just keep your foot strength up, keep your glute strength up, use it properly while you're walking, while you're exercising, and you're going to be good the rest of your life. Hey, if you want more details on how to solve this whole problem, like all the steps, I have my entire treatment approach. It's over 30 videos of me walking you through how to correct the problems, these root problems, and more. There's a lot more to it. And all the gradual steps you need to take to get to the point where you're doing everything you want to do. I have a program called the Patella Pain Recovery Program. You can learn more about it in the link in the description below. And I've also got all our videos that relate to patellofemoral pain syndrome linked in a playlist in the description below. So if you want to learn more about what we have to say on patellofemoral pain syndrome, go check out that playlist. If you want to just dive in to our program and get started on fixing the problem at the root and getting the swelling under control, then go check out our Patella Pain Recovery Program. Hey, give this video a thumbs up if you thought it was helpful for you. Subscribe to our channel if you haven't already, and turn on your notification bell so that you don't miss out on any of the videos we post in the future. Please share this with a friend as well. There's people out there that don't know why their knee is swollen, and they're going to the doctor, and the doctor doesn't know why their knee is swollen. They're getting pain medications, injections, maybe getting offered surgery, and they never get told to get their toes stronger, to get their glutes stronger. They get told to get their quads stronger, in fact, and that worsens the problem. And it's just that as a healthcare community, we don't really know what this problem is and how to solve it. They just try things. But this stuff works. We see people getting better all the time. And if you've been helped by one of our videos or by watching our programs, please drop a comment below and let us know how it worked out for you. Other people need to see that, and it makes our day, honestly. We all yell and cheer in the office, and we love to hear it. Thanks so much for watching, and I'll see you in the next video. Bye-bye.